Hello, my name is Veronica Hardina, and today I will be speaking to you about bullying in schools. I will discuss its etiology and how the counselling psychologist can provide specific services to address this complex form of aggression. It is important to research the causes of bullying and effective interventions because of the overwhelming evidence of the negative impacts on all of those involved. Bullying among children and adolescents is a serious global public health problem. It can lead to long-lasting psychological and psychosocial consequences, such as internalizing problems like anxiety and depression, and externalizing ones like conduct disorder and substance abuse. Some studies have demonstrated that many bullies, especially those that are bully victims, show elevated levels of psychopathology. What is bullying? Bullying constitutes a pattern of behavior rather than an isolated incident. It gets worse if left unchallenged. It's a complex form of interpersonal aggression between the perpetrator and the victim and is defined as repetitive aggression over time from one or more people. It is purposeful and done with an intention to hurt. It also involves a real or perceived power imbalance between where the victim feels vulnerable and unable to defend themselves. Bullying can take many different forms. It includes direct physical harm, such as pushing and hitting, as well as verbal harassment, such as name-calling and verbal taunting. The most common form is that of relational or social bullying, which includes rumor spreading, intentionally excluding a person from a group, obscene gestures, and humiliation. A 2017 UNESCO report estimates that the proportion of children and young people affected by school bullying specifically vary between countries and studies, ranging from as little as 10% to over 65%. According to another recent Australian study, bullying victimization experienced among children and adolescents in a 12-month period was estimated to be 15%, while self-reported perpetration of bullying at 5.3%. The social ecological framework has been widely used by researchers to explain bullying and victimization. The model was developed by the psychologist Yuri Bronfenbrenner to understand the relationship within one's environment as they relate to personality traits cultivated from childhood. It was later adapted to be used as a theoretical explanation of bullying. The model suggests that children are nested within multiple systems that interact to influence their development and are multi-directional. The factors include individual, family, peer group, school, community, and society. Within the individual category, a perpetrator of bullying has been identified as having risk factors such as callous and unemotional traits, conduct problems, antisocial personality traits, susceptibility to peer pressure, anxiety, and depression. Risk factors associated with the victim are linked to poor health and poor school adjustment. It is also associated with internalizing and externalizing difficulties, including loneliness, withdrawal, and social avoidance. Family influences, such as a lack of discipline, parental conflict, and domestic violence, have been found to contribute to bullying. Interestingly, family influences on victimization are not as strong. However, an association between being a victim and abuse have been linked to neglect and overprotective parenting. The peer group context is a major force in contributing to bullying and victimization, and it includes the important bystander effect, a strong predictor of bullying. Lastly, the school environment matters because a positive or a negative climate at school can have an impact on the frequency of bullying and victimization. For example, high levels of bullying and victimization have been linked to a lack of teacher support. Bullying is addressed through a whole school prevention programs and through individual therapy. The school-wide anti-bullying prevention programs have been found to be effective in reducing bullying in schools and have been implemented in Western world. The Friendly Schools project is such a program implemented in many schools across Australia. It is used to tackle bullying through a comprehensive and multi-component program with different levels of influence. The levels of influence include student, parent, class, teacher, and school community. However, it is crucial to complement the school-wide approach with individual therapy. A counselling psychologist can deliver a more targeted treatment to reduce bullying and minimise its harmful effects. Therapeutic approaches delivered by counselling psychologists can include individual therapy, psychotherapy, group therapy, and cognitive behavioural therapy. CBT is the most commonly used intervention with children and adolescents involved in bullying. Cognitive restructuring has been identified as an essential element in bullying interventions, as cognition about one's bullying experiences contribute to the development of internal and externalizing problems. A new evidence-based approach used to strengthen bullying interventions is called Preventure. It's a brief CBT-based personality-targeted intervention. The theory behind it is that, consistent with the socio-ecological framework, which an individual's personality interacts with pertinent environmental factors, such as family and peer relationships, maladaptive personality traits, and adverse environmental factors that can mutually reinforce each other can lead to bullying. Personality is an important factor to target because it influences a range of other risk factors such as anxiety, social skills, and other conditions. The Preventure program is a brief group-based intervention for individuals with personality types that have been linked to bullying risk factors. These personality types are hopelessness, anxiety sensitivity, impulsivity, and sensation seeking. The program is delivered in 2 90-minute group sessions, 1 week apart. The groups are divided into each of the mentioned personality profiles and are based on motivational interviewing in addition to CBT. In session 1, it includes goal setting and psychoeducation about the personality profile being targeted, along with common problematic coping behaviours for that particular personality type. An introduction to CBT model and practice in applying it to their own experiences is also given. Session 2 includes the student receiving psychoeducation about unhelpful thinking styles associated with their personality profiles, and they practice identifying and challenging those beliefs to be more able and capable in achieving their goals. This is a promising new treatment that can be employed by counselling psychologists to individually target susceptible individuals at risk of experiencing harm as a result of bullying. In conclusion, traditional bullying and cyberbullying are complex behaviours arising from multiple dynamic interactions within a child's social ecological system. School-based bullying intervention needs to be holistic, that is, school-wide and individual, accounting for interrelatedness of bullying and other emotional and behavioural problems among school children. In addition to the effective whole school programs in place, counselling psychologists should target individuals at risk with evidence-based programs such as Preventure. Thank you for listening to my presentation.